one of the reasons that this conversation is so important and hearing from you is so important because, you know, you're directly affected. You know, people, multiple people between the two of you who have lost their lives to this really preventable disease that doesn't have to happen. And there are so many conspiracy theories and inaccurate information out there about the virus and about the vaccine for COVID-19. Tell me about the reactions of other people, particularly those in our community, when you mentioned to them that you're participating in a COVID-19 vaccine trial.
They just, the people that my alumni members, they're all nurses. You what? Oh, and I suggested that they could participate. This was when I first joined, and it was still taking new candidates. They all said, no way. Now, I do understand that just about everybody's retired, but they're still in the community. They still go to the store. They still want to go to church. But they all shook their heads. Nope. I was really surprised. I was surprised. But there are some that I have talked to since then who are willing to get the vaccine now, whenever it becomes available to them. And they're all senior citizens. Okay, we're all seniors. But they are willing now. Some of them are willing now to take the vaccine. But before, in September, no, absolutely not. So I think talking to people, letting them know that it is safe. This is the only way we're going to get through this does help. It's not the end all. A whole lot more has to be done to get people to understand that we got to get through this some kind of way.
Yes, we do.
And
yes,
see, I always tell some buddies of mine, I say, well, my medical advisor, which is my wife, I'll tell anybody, oh, my medical advisor. And, you know, I told them about that. They rejected, some of them rejected the fact. Some of the fellows that I used to play tennis with a lot and everything.
I mean, but it's not surprising to me at all. You know, when you look at the conspiracy theories that are spreading on social media and in other venues, a lot of word of mouth, kind of person to person spreading of misinformation, it sounds like, you know, Marsha, with your medical experience, that you are one of the trusted voices in the community. You mentioned earlier that, you know, one of the reasons that you participate, or you knew that people would ask you about this and you wanted to be able to speak from personal experience, and that they would value what you have to say about this. And clearly your primary advisee values what you recommend in terms of your health and about this vaccine. For more information about COVID-19 clinical research opportunities, or to learn about the COVID-19 vaccine, please visit covid19community.nih.gov.